sure.
Okay, so Dr. Ricordi, can you tell me exactly what's going on in your lab these days? What's the latest cutting-edge research that you're doing dealing with type 1 diabetes?
Well, we now have a very exciting time because we finished the phase 3 trial, FDA phase 3 trial. That is what we were discussing with the director of Cyber FDA, Peter Marks, today, how now to move islet transplantation for the most severe cases of type 1 diabetes towards an approved procedure. So the challenge, the statement of the problem is the fact that we have now this 1.2 million patients with type 1 diabetes in the United States, of which around 70,000 have these recurrent severe episodes of low blood sugar that are life-threatening and for which there is no other therapeutic option. So in these cases, islet transplantation can be considered a life-saving procedure. So now our objective is to try to go through the biologic license application, some kind of facilitated approval, and make this available to patients in the United States, like most patients are already enjoying worldwide from Canada, England, France, Italy, Switzerland, Australia. So we are behind a little because our regulatory path has been more complicated, but hopefully this will be a very exciting development in the next couple of years. Then the other aspect that is interesting is that we are now tackling the last barrier, that is how to perform transplantation without anti-rejection drugs that now limit the applicability of this procedure to the most severe patients. So, of course, we would like to treat everyone, children, type 1, type 2. The 430 million patients worldwide are affected by diabetes, which as a toll is killing 5 million people a year. And so to get to a procedure that can treat all and not just the most severe cases, we need to develop strategies that allow transplantation without anti-rejection drugs. And that is the core of all our research now. Intervention trial, immunomodulation, new therapies that rebuild the capability of the immune system to tolerate cells transplanted or fight autoimmunity without the need of this generalized immunosuppression that lower your ability to fight infection and cancer.
So the challenges, you had said, are regulation and also the cost. Are those the challenges in the United States?
United States, the procedure costs like 8 times more than what it costs in Europe or in Canada. So that is part of the challenge that our entire health system is becoming so expensive. Like we spend $3 trillion a year in healthcare. And at the core of this issue is the fact that FDA regulate approval but don't enter in the definition of cost for that product. While in Europe or in Italy, like the equivalent of the FDA approves a therapy, it says you're approved at this cost because we know exactly how much it costs to you to manufacture, and we know how much you can gouge the system to deliver. Well, here is like you get approval and then is the Wild West. How much can we get out of a therapy? We heard today therapies for cancer or for blindness approved with reimbursement of $600,000, $850,000, which is really beyond my ability to understand humankind in a way.
So how are patients going to deal with that?
Well, it's clearly, it will make unsustainable economically to make healthcare available to everyone. It will become more and more therapies that are available to elite people that can afford either to pay or desperation that make you sell your house to treat your child from blindness or access a therapy for cancer. But the sad thing is that if you don't challenge, the real issue is not whether healthcare should be made available to all or to less people, is how much it costs. It's unsustainable economically no matter what. It's like some people say you get away with murder, both from Trump to Bernie Siegel. It's like the opposite sides of the political arena. So it's a ground for bipartisan political action if someone will have the courage to take over, to take up with an industry that is $3 trillion a year. So it's quite a big lobbying system and powerhouse and legal system behind that you have to face.
So you also mentioned manufacturing the isolates. Is that an issue here in the United States with the FDA, a challenge?
No, manufacturing is, they say you have to standardize and regulate. The challenge is that islets are organs, are microorgans, are only half a millimeter in diameter, but they comprise thousands of cells. So you cannot regulate thinking with the paradigm of drugs because they're not drugs, they're not uniform. You don't start from the same raw material. It's not a small molecule that can be, it's not even a cell, like an expanded stem cell or mesenchymal stem cell. You could say, we can standardize the protocol and you always have the same cell product. Islets is more like a organ transplant, like an art. You have to be trained month, year, and then when you have enough experience, you can take a pancreas from different donors, different age, different cause of death, different ischemia time, all kind of characteristic factor content, and then process that organ at the best of your knowledge and extract cells that are viable, that produce insulin, that will produce a biologic effect when you transplant them in the recipient. But to think that you can reduce islet transplantation to a standardized procedure like you could do with mesenchymal stem cell or a stem cell single cell product is impossible to realize. They're much closer to an organ transplant, to a drug pharmaceutical as far as ability to standardize.
Thank you for your time. Please keep up the good work.
Thank you. That's the reward.